Drew was like the mayor. He would go down the street saying hello to everybody. He would know everybody's names. He had a great personality. He was feisty. He loved music. He loved the color orange. He was a ball of energy.
Go, Bucky, go! Go, Bucky, go!
When Drew was almost 3 years old, we thought he was having a febrile seizure, and that was our first visit to UMass, to the pediatric ER. For about a year, we spent 50 to 75 nights or so between 5 East, the ER, ambulance runs, and the PICU.
He went from being a perfectly normal, functional kid to being very, very ill, and he almost started to reset, and he started to come back. He started to talk again, started to walk again, started to do everything. He was seizure-free for a number of weeks. He went back to school, and we just said, oh my God, it's a miracle. His neurologic team said, you really need to get away for a couple of days. Unfortunately, while we were gone, right in the middle of it, we got a call that he had been rushed to the hospital. He had passed away. They kept Drew at UMass for us, and when we went in to see him, Dr. Bateman was there, Dr. Marshall was there, his nurses were there. That's something that they don't teach in medical school or nursing school. That's what UMass is. After Drew had passed away, we decided what were we going to do to keep his legacy alive.
That's when we started doing the fundraising, and now we're in our 8th derby for Drew.
We continue to give back to UMass. It's left such a mark on us and such an impression. And it's not just us, it's countless and countless families.
We're Megan and Brian McDavitt. We had a set of twins in 2018 that were born at 25 weeks, Chuck and Luke, and our son Luke passed away shortly after they were born. We spent 100 days in the NICU, so that began our NICU journey. We also now have a 4-year-old named Millie, so our family is very blessed. The boys came at 25 weeks. We were able to see them, we were able to kiss them. Then we had to make the decision to end efforts on Luke, but that gave us the chance to allow him to pass away while we were holding him, which was really special. Chuck was fighting for his life as well.
The next 100 days was really just a whirlwind journey for us. You know, he used basically every piece of medical equipment that the NICU had to offer. You know, he was intubated twice, he had blood transfusions.
Having a NICU experience is not something that we ever expected. So to make sure that what happened in our story is meaningful, and if there's some form of positivity that we can cull out of it, we want to hold on to that. Our primary nurse, Diane, is a runner, and she does a lot of 5Ks and other marathons and half marathons. So we were chatting about that with her, and she mentioned that another family who had lost a set of triplets was organizing this 5K.
So we renamed the 5K to the Tiny Footprints 5K 2 years ago. The 5K is really geared towards 2 groups of families that have experienced a loss, and then families that have had a NICU stay. Every year, the proceeds from the event and everything that we're trying to fundraise for is the NICU and for the annual memorial service for families that experience a loss.
When I get to meet families like the Stevens family or like the McDavid family, I get overwhelmed because I can't imagine some of the things that they go through, and I'm so grateful and proud to know them. These events are so inspiring, and they bring community together to grieve, to have some joy, to remember the spirit of life that these children had, and also that spirit of community to give back.
Our donors really help us enhance what we do here and do it better. We are able to have lots of different tools in our toolbox, animal-assisted therapy being one of them. Seeing a child light up in a room after a tough couple days when Valentina walks through the door. We have programs like music therapy that, again, can transform a space. I can't tell you, how many times a kid comes to the playroom and parents are, in the corner tearful because they're just so grateful to have their child feeling better and being up out of bed. None of this is possible without the generosity of our community.
I find that we're telling our story a lot, which for us I think is therapeutic. It keeps Luke's memory alive.
Drew's legacy is living on, and he's making it better for other kids.